What is the internal urethral sphincter of the bladder? Have you ever wondered how your body controls urine flow? One key player in this process is the internal urethral sphincter. This ring of smooth muscle is located at the junction where the urinary bladder connects to the urethra. Its main job is to control the passage of urine from the bladder into the urethra. This muscle works involuntarily, meaning we do not consciously control it, and it plays a crucial role in maintaining urinary continence. This means it helps prevent urine leakage when the bladder is filling up. Anatomically, the internal urethral sphincter is continuous with the detrusor muscle, which is the main muscle of the bladder wall. However, they differ in both structure and function. The internal urethral sphincter is made of smooth muscle and is controlled by the autonomic nervous system. This system has two branches that manage the sphincter's activity, the sympathetic and the parasympathetic nervous systems. During the bladder's storage phase, the sympathetic nervous system keeps the sphincter contracted to retain urine. When it's time to urinate, the parasympathetic nervous system kicks in, relaxing the sphincter and allowing urine to flow out. Functionally, the internal urethral sphincter creates a high-pressure zone at the bladder outlet. This pressure helps prevent involuntary urine releases. When you decide to urinate, signals from the brain reduce sympathetic activity and increase parasympathetic activity. This change causes the sphincter to relax and the detrusor muscle to contract, which helps expel urine from the bladder. In males, the internal urethral sphincter also plays a role during ejaculation. It contracts to prevent semen from flowing back into the bladder, a process known as retrograde ejaculation. From a bladder health perspective, the proper functioning of the internal urethral sphincter is essential for preventing urinary incontinence. If this muscle or its nerve control is impaired, it can lead to issues like urinary leakage or retention. This is particularly important in conditions such as bladder cancer, where treatments or surgeries might affect the integrity of the sphincter. In summary, the internal urethral sphincter is an involuntary smooth muscle at the bladder neck that is critical for urinary control. It is regulated by autonomic nerves and is involved in both urine retention and controlled releases. Maintaining its health is vital for normal bladder function and is an important consideration in managing bladder-related health issues. Always consult a healthcare professional for personalized advice regarding bladder health.